Hi, my name is Kara. I'm a nursing assistant here on North Tower 5 Maternity. I have baby Lennon here and I'm going to demonstrate a bath. So we're starting with the towel down and we're just going to put her down. Oh, it's alright. Sometimes babies don't like this, and I always tell parents that once they can be submerged, when their umbilical cord falls off, they usually like it a lot better. So I have some water here. It's warm. It's good to the touch to my forearm. So that means it's good for baby because that's usually the most sensitive part of your body. So first I'm just going to take a washcloth with no soap, and we're going to do this on her face and her hands. So we always start with the eyes. So we want to avoid infection in the eyes. So we always like inner corner out. And then you kind of switch positions on your washcloth in between each eye. And now we can just go around the head, just in a little circle. You can get the nose and the outers of the mouth, and just the outers of the ears and behind. I know. And then her little hands, you always want to make sure you open up the fingers and get any hairs that might be in there. Alright, and then I always switch washcloths. So now we just move on to her body. And we can keep her covered. Once she gets wet, it's easy for them to get cold. So it's good to keep them covered as you go. A little trick, I always keep the soap in the warm water. Kind of warms it up for them. You just use a little quarter-sized amount for her body. And yeah, we're just going to start with her arms and her chest. And you want to make sure you lift up under their necks. And get all the milkies out of there, because it's really common for them to dribble under their necks. And I'm kind of rolling her to her back and doing this side of her. Same thing on this side. Back. No. Alright. Now I'm just going to rinse her upper body with just a fresh washcloth, just to keep her dry and warm. Yeah. You got the hiccups? Alright. Now we can get some soap. I know. And keep her dry. So the sponge bath ideally should only be 5 to 10 minutes long. Babies lose temperature really quickly. So we try to be quick. And you should always make sure your room temperature is also increased. I'm just doing her feet behind her knees and everything. And now this is the part after we would rinse and dry her legs that we would do her diaper area. So you would just make sure you wipe front to back for girls, and for boys, if they were recently circumcised, just avoid that tip of the penis. And then after that, just make sure you get under their scrotum really well and get all of everyone's creases because everything hides. Alright, let's dry you off. So when babies are new, I usually save their hair for last. Just because it usually takes the longest and it can be the most dirty. So I'm just going to wrap her up. Oh, it's alright. I know. She's not happy with me. Alright. So now that she's wrapped up, and I'm just going to do her hair. So I just do it over the bucket of water. You start by wetting her hair down. Hi. What was that? They tend to like this part a little bit more. And I just put a little bit of soap right on their head and just use my fingers, just like you shampoo yourself. Just want to be careful of those fontanelles or those soft spots. And if you're going to comb, make sure you stay flat to the head and don't go into the head, just for the same reason, because of those soft spots. And this is a good time to get behind the ears, and you can kind of tip their chin back and get those neck folds again. I know. And now we're just going to rinse it off. I know. What'd we do to you? Alright. Just rinsing her off really well. And then taking another washcloth just to dry. You always want to make sure you dry their hair really well, especially before applying any hat. You don't want any moisture to get trapped under there. I know. After a bath is a great time to do skin to skin. help them re-regulate their temperature. Oh, no. It's okay. And at this point, we would get her dressed and swaddled back up, or place her skin to skin with mom or dad. And then once her hair dries off a little bit, we would put a hat on. So we can do that. Oh no. It's almost done. It's almost done. Oh, you looking? She's like, why is everyone looking at me? Why is everyone looking at me? Yeah. And we'll just swaddle her up. Oh, I know. Yeah. All right. And then we give her back to mom and dad and she's all clean. See, I'm clean.
Hi, I'm Nadia. I'm one of the lactation nurses here at UHS Maternity at Wilson.
And I'm Kalina. I'm the other lactation nurse here at UHS Maternity Wilson Hospital. And we're going to discuss in this video how to get you started in a breastfeeding journey well. We're going to start off first by just giving you a few tips. You're going to offer the breast every 2 to 3 hours. In the first 24 hours of life, there's a good chance the baby isn't going to latch every single time you offer it, but it's important that you give the baby the opportunity. Once baby reaches 24 hours of life, from there on, they do need to eat every 2 to 3 hours. We will help you figure out the best way to do that for your baby. It's important that each latch is deep, and we will help you learn how to do that. A deep latch includes the nipple and the areola, and you can feel a nice pull tug of your nipple without pain. Baby needs to be getting enough at the breast in order to stay hydrated and grow. This is indicated by the diaper output, and that is however many days old baby is, that baby needs to have a pee diaper for that day of life. So 1 on day 1, 2 on day 2, and so on up to day 6. And those are the bare minimums. After day 6, it should be a minimum of 6 pee diapers in a 24-hour period. The stool diapers are going to transition in color. So it's going to start out in the first couple of days, the thick meconium that's like dark brown. Then it's going to transition to a brownish green by day between 3 and 4. And then closer to day 6, it should transition to a yellow seedy stool. Baby should poop frequently each day. And a good goal is 4 stool diapers on day 4 and then so on. Remember, you are both learning how to breastfeed, and this takes a lot of practice for both of you. It can take a good 2 weeks or so for you both to really feel confident in what you're doing. What your body is making in the early days is called colostrum, and that is considered breast milk. It's very small in quantity because that's the baby's belly size. As you nurse frequently, every 2 to 3 hours, your body will start to get the signals to produce more milk. As baby's belly grows, your supply will grow also. Your first couple of days is just the colostrum, and your milk will eventually transition to mature milk between day 3 and 5, but for some moms it does take longer, closer to day 7.
So now we're going to show you some tips and tricks on how to position to try to latch your baby in the early days. Most often you'll be in bed when nursing, so you want to make sure that you set yourself up in a good position that's optimal for nursing. One of the things that helps early on is sitting up nice and tall, as long as your belly can tolerate it, depending on the type of delivery you had. And to help you get a little bit more movement to your arms and give you options for positions, you want to move your pillows vertically so that you have a little bit more to work with. For most moms, 2 pillows works pretty well, just to give you enough room around to get your arms around and for some positioning options. Okay, so once you're all nice and comfy, you're going to get baby ready. So early on, you want to make sure that there's least amount of bulk between you and baby's body so that baby's mouth can get nice and close to the breast. If baby's all swaddled up, unswaddle and strip down to like diaper, as long as we're nice and warm. We can always throw blankets on top. And the little arms that like to come up kind of in front because they like to be nice and tight, you're gonna kind of open them up to kind of give the breast a hug so that baby's body is nice and flat against yours in a tummy to tummy fashion. You always wanna make sure, no matter what position you use, and we'll talk about a couple, that baby's ear, shoulder, and hip is in a straight line. This will help baby just with eating optimally, just how we kind of sit straight when we eat. We don't turn our head and eat like this, we eat like this. So the first position we're going to look at is called cross cradle. It's one of the common positions that moms like to start off in because it's right in front, it's easy to see. So you're going to place your fingers, your thumb and your index finger at baby's ears, kind of cradling the neck here in this space. All your support is on the baby's back with your palm, and these fingers you can kind of wrap around the shoulder, like above and below the shoulder. So you have a nice grip of baby and gravity is not pulling too hard away from you. Second, once we're in position here, we want to make sure that we get the nipple ready. For some people, everyone has a different anatomy. So for some people, they may have flatter nipples that need to be everted. So you can use either some hand expression or a hand pump, which we can go over in more detail with you at the time that you're here. If you have questions, please ask. To make the nipple nice and firm, because that will help stimulate the baby's suck reflex at the top of their mouth. So once the nipple is ready and baby's in position, you're going to try to match up baby's nose to the nipple. If baby's too far forward, it's going to tuck baby's nose into the breast, and that's going to misalign the nipple but also make it harder for baby to breathe. So we always want to bring baby back so that when we latch, nose at nipple, baby comes up and over, and the nose is kind of in a sniffing the air position. So let's back it up for just a second. So we have baby tummy to tummy, fingers nicely at the ears, nipples ready to go. We're going to tease baby's upper mouth and lips with the nipple. And then when baby opens wide, you have to be nice and quick to bring baby chin first up and over to get a nice mouthful of tissue. What you're looking for is to see either very little areola or more of it above where the nose is than where the chin is, because that's the part that the baby needs to be to help milk the milk. You want to also pay attention to the baby's corner of the mouth. If you see lips that are nice and pinched, that's going to be too shallow. It's going to cause more pain for you over time or nipple damage, which we don't want. So a good latch, you can tell by a nice wide angle to the mouth with the lips flared out, both on top and bottom. If they're tucked under, it eliminates the seal, which can either get more air in or not be as effective as removing the milk. So we want to try to teach baby the right way to do it so that they get more out of what they're doing and it causes you less discomfort over time. Okay, so in summary, belly to belly, nose to nipple, ear, shoulder, hip in a straight line. You tease baby's upper lip with the nipple. When baby opens wide, you come up and over and hold the compression. So you're going to be compressing this breast, sorry to tell you that. Compressing that breast like a sandwich when you're teasing that upper lip so that it makes the area a little bit smaller for baby to come up and over too. So holding that compression until baby gets into a nice little suck pattern, and then you're going to release the thumb but keep the support of the tissue from underneath so that gravity doesn't slip it away. You want to also be listening for swallows. Swallows sound like a little k sound, maybe every 8, 10, 15 sucks maybe at the beginning, just because that colostrum, like we said, is very small in amount. And as your milk starts to transition more and more, it'll become more frequent every few sucks or so. The next position that we're going to show you is very similar in how you hold the baby, but the position is different. This is called football hold. So for football hold, you definitely want pillows behind you. You might even need a third one, depending on how big your baby is and how far you come away from the bed. The reason for that is, again, nose at nipple is going to be where you want to aim for baby. So the same position with the fingers at the ears and the neck supporting, or the hand supporting the back, but you want baby to be back far enough back so that the nose and nipple are able to be in alignment. Same thing, compression of the breast tissue, teasing that upper lip until baby opens wide, and then coming up and over, holding that compression until they get into that good suck pattern, and then releasing that thumb so that the milk can flow. A good breastfeed at this stage is at least 10 to 15 minutes of kind of active sucking and swallowing. And it could be longer, let baby go longer, as long as we're having those nice, good, deep sucks and swallows, then that's a good sign. Babies that are breastfed don't always need to burp, but you do always want to try to give them a chance once they're done. So there's a couple ways you can do this, but early on, doing it right in your lap where you're supporting the chin or the jaw with those same index finger and thumb resting on the jaw, and the palm of the hand is resting on the chest, and you're using gravity to help bring baby forward and giving nice, firm, but gentle pats lower on the back, kind of down where the belly would be, to get the little air bubbles out for little burps. Now, they don't always burp, but you always want to give them the opportunity. Lots of skin to skin in the early days will help with breastfeeding, and after feeding, keeping baby upright a little bit for like 15 minutes or so is helpful, and you can do that right on skin to skin with either yourself or a support person at that point, just to let them settle back down. Babies don't always take both breasts at this stage. However, if they are still hungry after the first 10-15 minutes, they kind of fall asleep, come and then start waking up again shortly after, you can offer the other side, but that might not happen until a little bit later. Hi, I'm Nadia. I'm one of the lactation nurses here at UHS Maternity.
And I'm Katrina, and I'm also one of the nurses at UHS Wilson Maternity. We're here today to talk about bottle feeding your newborn. So in a first 24-hour period, and from then on, you should feed your baby every 2 to 4 hours, with the first feeding be within the first hour or two after birth. The baby should initially take around 5 to 15 mLs, which is about up to ½ an ounce of formula. After that, they should be taking about 15 mLs per feeding for the first day. Once the baby hits the first day and they're into the second, they can take up to 15 to 30 mLs of formula. Once the baby reaches day 6, you should have slowly, gradually increased, as long as they're tolerating it, up to 60 mLs, which is 2 ounces of formula. How to get your baby feeding if they're sleepy. You're gonna look for feeding cues such as rooting, smacking their lips, trying to eat the air, and crying. Some ways to get the baby to eat if they're sleepy is to unwrap them, start skin to skin, or change their diaper. When preparing infant formula, you're going to want to read the labels on all the formula, whether it's prepared formula, liquid, or powder formula. Powdered formula, you're going to read the label and see how many scoops of formula you need to how much water. Make sure you're remembering to use bottled water or filtered water. You don't want to use tap water, or you can also use nursery water. It's important to know once you start feeding the baby out of the bottle, it's only good for 1 hour because of bacteria that can get in the bottle. If you are using prepared formula out of a multi-dose formula bottle, that bottle of formula is good for up to 24 hours in the fridge, as long as the baby had not drank out of it. How to clean your bottles. So it's important for new bottles to always be sterilized with a bottle sterilizer, or you can do it over the stove. And you're gonna want to continue to sterilize those bottles every day, once a day at least. And you're gonna wanna clean the bottles with soap and water and rinse thoroughly after every use. Also, with bottle care, you wanna make sure that you're not putting any formula in the microwave. You can warm the bottles as needed with under the sink warm water or a bottle warmer, and always make sure to check the temperature on your wrist to make sure it's not too hot. Okay, how to feed your baby. So make sure when you're feeding your baby, you are having your baby upright, never laying flat in the crib or on on the floor to feed. You always want the baby's stomach below their head when feeding. Make sure you're going slowly, as if they're choking, spitting up, or drooling out all of their formula, that you take breaks and burp them. And also make sure you're keeping them upright after feeding. If the baby isn't tolerating the feeds, they're choking, they might be turning blue, always want to make sure you're keeping the blue bulb syringe around to use in case, and definitely be calling the doctor with any questions or concerns with that.
I'm going to talk a little bit about bottle feeding with breast milk. All of the same feeding rules basically apply. However, some specific considerations when to start pumping and what to expect might be a little different. So if you are latching baby to breast, but baby's not latching consistently every 3-ish hours after the first 24 hours, you want to start pumping in place of the feeding. So if baby's not latching, you're pumping one or the other every 3 hours. In the early days, the colostrum that you have is that early breast milk is very thick and does not come out easily in the pump. The point of the pump is for stimulation to help bring your mature milk in, which takes about 3 to 5 days. If you do get little bits of colostrum, you can give that to baby. It's full of nutrients for the baby, and then if necessary, supplementation with formula can come after, which talk to your doctor and or us while you're here for your specific situation. After the first 3 to 5 days, once you get home, your milk usually will start to come in and you might feel some engorgement, and you'll notice that it increases in amount. This is expected, and depending on if you're exclusively pumping or bottle feeding or latching your baby, that might look different. With any questions, you can always reach out to lactation, whether it's breastfeeding, bottle feeding breast milk, or formula bottle feeding. We're here to help no matter what way you choose to feed your baby. So with breast milk, the freshly pumped breast milk is good at room temperature for 4 hours if baby has not drank from that bottle. Once baby does drink from that bottle, it is only good for an hour, just like the formula would be. Anytime you introduce bacteria into it, it has the potential to grow that could be harmful for baby if it's sitting around. If you get the breast milk into the fridge within the first 4 hours, it is good for 4 days in the refrigerator, and up to from 6 to 9 months in the freezer after that. In the first couple days while you're here, if you do get any colostrum out through pumping, generally you want to give that to baby and take advantage of that first colostrum while you can.
Okay, so when we're bottle feeding a baby, we want to make sure that what's different from breastfeeding babies is sometimes the babies only eat every 2 to 4 hours because breast milk is broken down a little bit quicker. So when bottle feeding, make sure you're feeding every 2 to 4 hours. During nighttime, you want to make sure you're setting an alarm at least every 3 to 4 hours to wake up and feed your baby if they don't wake up on their own. It's important to have at least 8 to 10 feedings in a 24-hour period for a newborn as well. And you're going to continue this until you go back to your pediatrician's appointments and they've changed or told you otherwise. It's also important to make sure you're writing down not only their feedings and how much they eat, but their wet and dirty diapers. So day 1, they should have 1 wet diaper and 1 poop diaper, and day 2, they should have 2 wet diapers, and it goes on a pattern like that to day 3, day 4, day 5, until day 6, they reached about 6 to 8 wet diapers a day. By then, they should have the black tarry meconium switching over to the seedy yellow and have about 3 to 5 poop diapers a day.
Hi, my name is Jessica. I'm a nurse here at UHS Maternity. Today we're going to be talking about safe sleep, the blue bulb syringe, preventing shaken baby syndrome, and car seat safety. So this is the safe sleep portion of the video. Sudden infant death syndrome, or SIDS, is the sudden death of an infant under the age of 1, but it most often happens at 1 to 4 months of age to a healthy baby who is sleeping. SIDS is preventable, but not predictable. SIDS can happen to any baby. There are ways to prevent SIDS, which includes the ABCs. So babies should be alone. They should be in the same room as the parents, but not in the same bed. They should be on their backs in the crib, laying flat and not at an incline. And they should be in the crib or bassinet or pack and play with no stuffed animals, no toys, and no blankets in the crib. There are ways to reduce the risk of SIDS, which includes tummy time that's supervised, breastfeeding, staying up to date on vaccinations at well baby checkups, using pacifiers but waiting until the latch is established with breastfeeding mothers, and avoiding overheating. So that means that you want to put baby in one more layer than what you would normally wear, and keeping the temperature of your house like high 60 degrees, low 70 degrees Fahrenheit. And lastly, avoiding smoking or secondhand smoke, as that can increase the risk of SIDS. The next topic that I'm going to be talking about is the blue bulb syringe. This is used when baby's choking, gagging, or spitting up. Baby can be choking, gagging, or spitting up on amniotic fluid from when they come out of a C-section delivery or a vaginal delivery. It can be used when baby is spitting up formula, breast milk, or mucus. Next, I'm going to demonstrate how to use the blue bulb syringe on baby. So what you're going to want to do is you're going to want to push the middle of the syringe with your thumb, and then you're going to insert the tip of the blue bulb syringe into the baby's mouth towards the side of the cheek. Tilt it more towards the inner cheek, and then you're going to release the blue bulb syringe suction, and most importantly, you're going to push out whatever secretions you've gotten out of baby's mouth onto either a burp cloth or a tissue or anything you have close by. And then if you're using a blue bulb syringe at home, you're going to want to wash it with clean soapy water, and if you're using it in the hospital, it's only good for hospital use. So the next topic that we're going to be talking about is preventing shaken baby syndrome. So have a plan should you become frustrated with your baby to prevent shaken baby syndrome. Never ever shake your baby. If you find yourself becoming frustrated, leave your baby in the crib alone in a safe place and count to 10 and take a deep breath. You can also leave baby in the arms of someone that you trust until you find yourself calming down. You can also rely on friends and family for support during this time, and reach out to your healthcare professional if you feel stressed and overwhelmed. So the last topic of this portion of the videos is car seat safety. So a car seat is designed based on age, weight, and height. At this point, your baby is an infant, and the car seat should be rear facing and in the back seat always. The car seat has straps and harnesses and is designed to cradle the baby's head, neck, and spine. So if you were to get in a car accident, those things would be protected. The most common type of car accident is a frontal crash, and the design of the car seat helps protect the baby. The car seat also has a harness. You should not put a blanket beneath the harness or behind the baby, as this can disrupt keeping the harness tight to the baby if you were to get in an accident. You could put the blanket on top of the baby but not behind it. And lastly, you should not put the baby in extra clothing, because that would disrupt the harness being tight to the baby.
Hi, my name is Sarah. I'm a nurse at UHS Maternity at Wilson Hospital. I'm going to talk about what it looks like in the first few days caring for your newborn and when to call the pediatrician. So during your hospital stay, a pediatrician will come into your hospital room and assess your baby, make sure everything looks great, baby looks healthy, assess things like your baby's weight, amount of diapers, formula feeding, breastfeeding, those kind of things, to make sure you're safe to go home. So before you leave the hospital, it's important to call the pediatrician's office of your choosing and schedule an appointment for your first baby visit within 24 to 72 hours after leaving the hospital. So you would make that appointment while you're still here, make that phone call. They always have those appointments ready on hand and available for newborn babies. During that first appointment, they'll be assessing things like baby's skin color, looking for that jaundice color, administering the Hep B vaccine, hepatitis B vaccine if that's not something you already had during your hospital stay. After your initial pediatrician visits, your baby will return to the provider at 1 month, 2 months, 4 months, 6 months, 9 months, and 12 months of life. At these appointments, weight will be monitored, making sure baby's eating enough, staying well hydrated, and on a good growth schedule. Weights and measurements will be obtained at every visit. What these visits will look like, when babies are still in that first month of life, we're looking for things like yellowing to their skin, what we call jaundice, can indicate baby may need to be monitored more closely or go under what we call phototherapy. We're also, again, monitoring weight and hydration status is the biggest thing here, and making sure baby's thriving and getting what they need at this point. Okay, so things to call the pediatrician for in the meantime of those visits. If your baby's missed 2 or more feedings or is vomiting most of the feeding that they've just taken, whether that be formula feeding or breastfeeding. Inconsolable crying, on not knowing why that may be, whether you've swaddled, changed the baby's diaper, offered a pacifier, tried to carry baby around, those kinds of things. Sometimes that could mean something's underlying and we're not quite sure why baby's crying and inconsolable. An unknown rash anywhere on their body. Babies typically get what we call a newborn rash. It's like a pimply, tiny red bumps. That's not so much something to be concerned of. More so hives that are raised and we're not sure where it's coming from. Call the pediatrician right away, or even call 911 if you think it's severe enough. The first few weeks with your newborn can feel like a whirlwind. Make sure you know there's resources available. Make sure you know you can reach out to your pediatrician with any concerns you may have. I promise they're expecting your call, especially if you're a first-time parent. Make sure you trust your instincts, go by what you feel is right, and you've got this.
Hi, my name is Maddie and I'm a nurse on UHS Wilson Maternity.
And my name is Caitlin and I'm also a nurse on UHS Wilson Hospital Maternity. Today we're going to talk about postpartum care for a vaginal delivery and C-section delivery. So the first thing we're going to talk about is bleeding. Obviously, as you know, there's some bleeding going on. Everybody has bleeding after delivery and that's normal. It's called lochia. And this will happen up to 6 weeks after delivery. It's a little bit different for everybody. It starts out heavy, a bright red, and then kind of transitions into like a darker red, changing over to like an orangish yellow color. Don't be alarmed by this. It's still normal. If it is like orange or yellow, that's normal. And then it turns into like a dark brown, like at the end of your period, but this is not considered your period. So after that 6-week period, you can get your period back after like a couple weeks, or it can take up to a year. It's different for everybody, but just know that it's not your period, so you can get a lot of bleeding like right after as well within a couple weeks. The main difference is you just want to watch out for like if you're saturating 1 pad per hour, passing blood clots bigger than your fist, or you notice like any abnormal odors, anything like that.
Along with bleeding, you're also going to experience some cramping. Cramping's different whether you have a vaginal delivery or a C-section delivery. You might have more intense cramping some other times. Cramping can also get worse with feeding times. That is normal, and they don't last more than 2-3 weeks. You can also take any prescribed pain medications. For a vaginal delivery, usually it's ibuprofen and Tylenol. And for C-section delivery, it's whatever your doctor prescribes you. Just make sure you follow all your doctor instructions regarding taking your pain medications. You're also going to experience some swelling. Swelling also looks a little bit different depending on how long of your labor process was. You may be swollen in your extremities, maybe a little bit in your face, your hands, your feet. Swelling can be normal, but if your swelling gets worse over time, or you notice that you have like a hard lump in your calf, your arms, you may want to bring that up to your doctor.
Okay. And then for after delivery care, it's a little bit different for a vaginal delivery and a C-section. So we're going to start with vaginal care after your delivery, and then she'll go into C-section. So after a vaginal delivery, like we said, you're going to have that bleeding, and then you're going to have like some vaginal soreness down in your perineum. You can continue to use like the peri ice packs and the topicals we provide you with, which is like a dermaplast spray and the Tux pads. You can get those over the counter as well. Those are kind of just more so for comfort, so you don't have to use those if you don't want to once you leave the hospital, but we do recommend it. It does help with that swelling and pain down there and burning. The peri spray bottle that we give you with the water, we do want you to use that until bleeding stops completely. That will help to minimize the risk of infection. With that said, showering after a vaginal delivery is pretty straightforward. You might have already showered here in the hospital. You just shower like normal. You don't have to do anything special with that. But just being mindful, like you don't want to obviously go too deep in there, just kind of washing everything normally though. No tub baths when you go home. You can't take a tub bath, you can't go swimming, no hot tubs, none of that. And another thing to touch on is you can't use any tampons or douches. Nothing can enter the vagina, so no sexual activity, none of that during this 6-week window. As for like exercising, you are okay to do like light activity, like exercise, so like going for a walk with the baby, that's okay. Getting out of the house, enjoying the nice weather, anything like that you can around here. So it just all kind of depends. But that's all okay. You can obviously do light house activities, chores, that sort of thing is okay. Going up and down the stairs is okay. Just nothing too strenuous. You don't want to overdo it. If your bleeding starts to pick up a little bit, it could be that you're doing too much and you want to relax a little bit. But overall, the care, you'll start to feel better after a vaginal delivery pretty quickly, so just making sure you're not doing too much.
And with C-section care, all the same rules apply. The only things that may differ is your incisional care. With your incision, you want to make sure that you're monitoring for any signs of infection. So redness, swelling, drainage coming from your incision. And if you notice any of these things, make sure you contact your provider. As far as showering goes, you want to make sure that warm soapy water is flowing right over your incision and you're patting dry with a nice clean towel, but you do not need to scrub the area. With restrictions, no bending over, lifting anything heavier than baby, and say no exercising for 6 weeks, no sexual activity, no tampons, no douches.
So we're going to move into what to watch out for and when to call the doctor. So I'm going to start, and we're going to probably start and end with this. Your OB office has an OB on call at all times. Some of you may know that, some may not have used it, but it's there at your fingertips. You can always call your office even if it's 3 a.m. and they will get a call out to the doctor on call for any issues. So don't wait till the office opens or anything like that for any of these concerns or any other questions or concerns. So just starting out, you want to watch out for any signs of infection, like we talked about before, fevers, chills, odors coming from like your incision site if you have one, or down there, making sure to call for anything like that. Any headaches, nausea, vomiting, epigastric pain, dizziness, visual changes, blurred vision, double vision, anything like that. Increased swelling in the hands, your face, your feet, anything that is out of the ordinary for yourself. If you have headaches that are persistent, you'd want to call for those as well. A lot of those are signs of preeclampsia that can happen after delivery as well. Up to 6 weeks, you're still at risk for that. So just watching out for those signs and symptoms as well. And then we talked about bleeding. If you're saturating 1 pad per hour, passing blood clots bigger than your fist, you want to make sure to call for that as well. Those are all reasons you'd call the OB. Now, you would call 911 for a couple things. If you're having any difficulty breathing or chest pain, or you have a red area on your calf that's warm or painful to the touch, that can indicate a blood clot. So those are more urgent reasons that you'd want to call 911 and before reaching out to your OB and get seen right away.
If you have any questions, comments, or concerns, you can contact your OB for any further information.
Next, we're going to talk about postpartum depression.
Just wanted to talk about baby blues, that those are the feelings of happiness and sadness that you feel for the first days postpartum and then up to 2 weeks after having baby. Those should resolve in time without any medical intervention and without calling the doctor.
Postpartum depression goes beyond that. It can happen up to a year postpartum, but the most common occurrence is 2 to 3 weeks postpartum. This includes feelings of depression, anxiety, feeling like you're unable to care for yourself or your newborn.
There are many causes for postpartum depression. There's lifestyle factors, there's fatigue of having a brand new baby, feeling exhausted, feeling like you can't keep up with taking care of baby and taking care of yourself. There's hormonal changes since you just had baby and those are starting to regulate themselves. There's also another component of having a history of depression. So if you've had depression in the past, if you're currently being treated for depression, or if you end up developing depression or have a family history of it, that can lead to developing postpartum depression.
It is very important that you talk to your OB provider immediately if you start to have symptoms of postpartum depression. Don't wait till your routine follow-up appointment. Call your OB immediately.
If you need additional resources regarding this topic, then scan the QR code on the screen.